Good morning, everyone. My name is Megan McKelvey, and I'm the manager of member and department services here at the League of California Cities. I want to welcome everyone to the impacts of COVID-19 and public safety on children. All Children Thrive is part of the solution webinar. COVID-19 has rapidly changed the way that cities operate, and in order to meet these moments, the League has been producing this webinar series for cities to learn from each other. But COVID-19 has affected all of us. During this webinar series, we've talked about everything from shutting down a city to reopening a city. But how has COVID affected one of our most vulnerable populations, our children? Today, we have a representative from the public health advocates here to talk about the increased health inequality challenges that many of our children are facing during COVID-19 and systemic racism, and what cities can do to support our youth. This presentation is a part of the All Children Thrive California Initiative, which is an equality-focused, city-based, community-driven effort to prevent and counter childhood trauma and foster community healing and resistance. Before we get started, let's do some quick housekeeping. If you're planning on speaking today, please make sure that your audio is connected. You can find out if your audio is connected by clicking on the audio settings. All attendees have been muted upon entry, and this webinar will be recorded. For this webinar and our other webinars, a part of this series, please visit cacities.org/coronavirus. Now, how to ask a question. We're both taking verbal and written questions. If you like to verbally ask your question, please click the raise your hand button and we will call on you once we hit the Q&A portion. However, if you'd like to write your question, please just type it into the Q&A button and we will get to it. So I'd like to introduce our great speaker, Dr. Kofer, who is an epidemiologist who serves as the Senior Director of Policy for Public Health Advocates. She oversees the state policy efforts and the All Children Thrive California Local Trauma Initiative. Doctor, I'd like to turn it over to you. Thank you so much for coming and participating in our webinar.
Thank you so much for having me. I really appreciate being able to be here. And I'm really glad it's not allowing me to share my screen. Oh, there it is. Okay.
Here we go.
Awesome. Let's see.
Again, audience, please feel free to ask questions in that Q&A, and we will get to all of them.
Hit share instead of present. All right, so good morning, everyone. Thank you so much, Megan, for that really warm introduction. I'm really pleased to be here with an organization that I consider to be one of our longtime friends and partners. What we're going to be talking about today builds on a decades-long relationship that we've had with the League of California Cities and many cities throughout the state of California through our HEAL program, Healthy Eating and Active Living Cities program. And so we are really, really thrilled to be back and be expanding upon so many of the lessons we've learned from HEAL Cities and really thinking about what's on the next frontier for cities as they are responding to a pandemic, our first pandemic of this sort in over 100 years, and also contending with some of the deep and seemingly intractable issues that have been really, harming our communities and posing a threat to our children's well-being for a while, that we now maybe have the awareness and political agency to begin to work on. So for today, what we're first going to talk about is COVID-19 and some of the disparities, because it's really clear that there are disparities related to COVID-19 and that we need to be paying close attention to those. Also thinking about public safety and police brutality, and we recognize that that's been dominating the headlines, and so we want to make sure that we're having a conversation that's rooted in the context of what has this year brought for us. And I've been jokingly saying that this year feels like a decade, and so congratulations, today is the end of the first 5 years of 2020, and good luck on the next 5 years until we reach New Year's Eve. And then also thinking about, All Children Thrive being part of that solution of how we will be able to address some of the issues we've seen. And then we certainly want to make sure that we end with the ask, never leave without making sure that it's really clear how you can be involved in this work. So when we think about trauma, I need to root everything we're experiencing it through this lens, because trauma is an event or a series of events or circumstances that's experienced by someone as physically or emotionally harmful or life-threatening and has lasting adverse effects on the individual's functioning, mental, physical, social, emotional, and spiritual well-being. And that's a really technical way of saying that when things that we are unable to control that are threatening to us happen to us, that it really can change the way that we function. And so I know many of us, on this webinar have had to deal with feeling a little bit out of control. The way I've been describing it is you never spent this much time with your kids being the upside, and the downside being you've never spent this much time with your kids and other people that you live with. And so there are all of these things that we're contending with right now, while we are also recognizing that there is a virus that did not have a name 6 months ago, that we are all contending with as, what is our risk? Is this going to harm us? Is this going to harm our relatives? While every day we watch the case count and the death count continue to tick upwards. And so we have to take a step back and realize that even though you're on this webinar right now, and even though we're doing all of this work, we are experiencing a trauma. We are in the midst of a community trauma that is impacting us. And one of the things we've been thinking about is, what are the long-term impacts of this? Will we be wearing masks for the rest of our life long after, COVID-19 has gone away because of what happened? I distinctly remember my grandmother, who was a child of the Depression era, continuing to hoard food for the rest of her life, having multiple refrigerators and freezers because of the impact of that time in her life. So recognizing that this is not just a moment, but this is something that is going to define all of us, no matter what generation we're in, but certainly the youth and how they grow and how they view the world and how they're experiencing it right now. So our current realities as it relates to this are that COVID-19 is negatively impacting children, especially those that we already knew were most vulnerable. So if we think about this from an equity perspective, we already had disparities between groups of children in the state, and that COVID-19 has made those worse, has exacerbated those. COVID-19 has also affected, communities unequally, right? So those inequities that were in place for those vulnerable children, that now those gaps are even worse than they were when we started. And the other reality is that we are experiencing one of the biggest sort of racial uproars or racial reckoning, as some people have described it, in recent history. And when you're thinking about, children of color, and in particular Black and Indigenous children of color, they have been re-traumatized by witnessing constant police brutality against African Americans, as well as against our Latino populations and our American Indian populations. And so we have to recognize that these two things are happening at the same time to people who are trying to figure out how the world works and trying to understand what they're seeing and experiencing. We also have to recognize that in the midst of this COVID-19 pandemic, that we are seeing clear disparities along some of the lines that many of us could have predicted in terms of who has been most impacted. And this is entirely explained by structural racism. And I put entirely because when we look at the patterns of what we're seeing, it is a confluence of all the factors that structural racism and oppression have touched on. So when we look at jobs, we've all been sort of talking about this as people working from home, but we recognize that, especially among our Black and Latinx communities, that only 25 to 35% of people are working from home, and that Black and Latinx folks have been the most likely to experience job loss and wage loss during COVID-19. So again, everyone experiencing this pandemic, but some people being more impacted by it. Also being more likely to be essential workers, especially those essential workers that are in lower wage jobs that have closer contact with the community. Being incredibly represented among our transit drivers, among those who are doing the cleaning and janitorial service jobs, among those who are food service preparers. And so when we recognize that, that means that those are the jobs that didn't shut down for those who still have them, but often were already jobs that didn't necessarily pay the greatest wages, and are also putting people at risk for infection because their job interfaces with the community. We certainly understand the role that healthcare plays in our ability to be able to care for ourselves, especially in a pandemic, and recognizing that geographically already, Black and Latinx folks have the least access to healthcare, both in terms of insurance rates and also in terms of actual physical access to the care. And we recognize that racism is a thread that runs through that as well, that the type of care and the perception of even severity of symptoms certainly differs. And we heard reports in the early stages of COVID-19 where people weren't always getting the same level of healthcare. When we look at housing, where people live has had a big impact on their risk for infection. We're now seeing that the greatest risk right now are people who have been in bars, which is why so many of them are shutting down, and people who are having home gatherings or live in close proximity to others. Originally, it was our nursing homes. Now it's people who are living in closer proximity to one another, and for whom there are people coming in and out of their home where distancing and masks are not being used. And then certainly transit plays a role. Those relying on public transit have a lesser access to being able to distance themselves, and certainly those working for transit as well. And so the combination of all of these things creates the economic stress, it creates the personal stress, it creates the stress and worry of caring for families. And then racism is layered on top of that. And so what we see is this historical and ongoing cycle that's driven by the social determinants of health, of where you live, of where you've been allowed to live, of what kind of jobs you get, of what kind of quality education you get, of what level of stress you're under, and the force of racism that results in an increased risk of infection and also an increased risk of complications because of underlying conditions that, again, were the same effects of these social determinants of health. One of the things that's really important to point out is that, Native people are undercounted and underreported in all of this. And so we frequently want to talk about the communities that are most impacted. And sometimes what that means is the community that's impacted so much, but counted so little that they don't even show up in the statistical numbers. And so we have to lift that up as well, that there are disparities that we're seeing. And even what we do know is an representation of cases among our Native folks. And so while all of this is happening, the dominant narrative has been, but the kids will be okay. The kids are not as affected by this. This is not as big a deal. And what we're not recognizing is that the kids are very much affected by this. They are paying attention and seeing they've had their entire social networks disrupted because of school and childcare centers often being the way that kids connect with one another. For our youngest children, the ability to be able to touch and play has been significantly hampered. And that has an effect on their mental and emotional well-being, even if they're not able to say in clear words, I am struggling. We know that is the impact regardless. And so COVID-19 is having a disproportionate impact, not only on communities in terms of infection rates and complications and even the mortality rate, but also on how it's impacting the communities that maybe are not experiencing the individual impact of the pandemic, but certainly are dealing with all of the stressors and those social determinants of health that are struggling right now. But I think, since we brought this up, we are all in this together. And I liken this to being on the Titanic, which is everything is 100 years ago right now. This pandemic, last time we had one was 100 years ago. And the Titanic, which was the big ocean liner that sank, that was deemed unsinkable, over 100 years ago as well. And one of the things that when we have this refrain of we're all in this together, it's true. There's almost no one on the planet at this point who has not been impacted in some way by COVID-19. The difference, though, is that similar to the Titanic, more third-class passengers died than first-class passengers. Men died more than women and children, and first-class women were more likely to survive compared to third-class men. And that is the confluence of equity factors that we're talking about. We recognize who was prioritized to get into the limited lifeboats and what impact that had on the overall survival rates. So similar to the Titanic, we are all in this pandemic together, but we also need to recognize that among those that are most vulnerable are our children, because developmentally theirs is still in progress. And also when we look at our children who are lower income, our children who are also people of color, especially Black and Indigenous people of color, that they are in this with us, but they are not experiencing this in the same way that those whose experience may skew more on the sides of inconvenience and not on the sides of peril. So what we're talking about here is the need to think about all of these things through the lens of structural racism and through the lens of trauma. And we, because of our definition of trauma, of understanding what this means, we recognize that trauma comes in many forms and can come from many different places. And part of what we're trying to address right now is what does it look like when that racism doesn't show up as somebody who has something negative to say about you, but it shows up in the ways that our institutions function, and it continues a cycle of harm, even sometimes when there may not be racial animus at the top. And that's part of the reason that we shift away from just looking at attitudes, but also looking at the structures and the policies that are in place and how those affect our lives. And so if we think about this in the context of what we've seen over the last few weeks, which has really been this conversation about the role of policing in America, we have to recognize that, a lot of times we talk about racism being in sort of America's DNA from its outset because of the way that this land was acquired through genocide and through lies and manipulation, and also then through the free labor that was extracted from people who were stolen and brought to this country to work that land in the service of capitalism. And so it's really important that we understand, though, how this has been going on and what impact that has on our functioning. Everything from, our slave patrols that were really sort of the first policing systems in this country, to the reconstruction of the Ku Klux Klan, to convict leasing after the period of enslavement was over, and that became the way of being able to extract labor from people, and the mass incarceration that went along with that, to the lynchings that really forced the Great Migration for people to leave the South and find other opportunities elsewhere, to the civil rights, and police assaults on protesters that we have seen, during the civil rights movement, but we're certainly seeing again in some of what's happened over the last year, but certainly even the last few weeks. And of course, then the war on drugs and incarceration, which has been taking place over a period of 60 or 70 years at this point, and certainly has linked together policing and over-policing in communities, and the way in which that plays out in the relationship that people have to structures, but also on what's happening within a community. And so this is what we were contending with when what we saw on television, what we were seeing in our media was this institution that we fund and that we support, and that is seen as part of public safety. And yet we were seeing the exact opposite on TV, and we were really having to contend with an entirely new generation of people engaging in civil, unrest and civil disobedience, and being met with violence once again. One of the turning points of the civil rights movement in the 60s was the visual images of what was happening to protesters. And we are once again revisiting that conversation 2 generations later, to the same end of what does this mean and what needs to change in order to stop this. And so the calling this a racial reckoning, calling this a moment of reckoning for America is certainly important in that context. But we also have to recognize that while the racial reckoning has largely been predicated on the deaths of mostly, Black men in particular, at the hands of police officers, and what that seems to indicate for the overall structure and some of the challenges of that institution, that this goes beyond certainly the men who are more popularized to even including women, and that's often not discussed, but also including other people of color, and it extends, other ways that we've used structural racism throughout the history of America, from forced sterilizations, from the ways in which many of the folks who didn't immigrate to the United States have been treated, the Chinese Exclusion Act, the ways in which, our Japanese Americans were detained during World War II, even to more recently what's happened in Standing Rock with the Sioux people around the Dakota Access Pipeline. And so we see this structural racism playing itself out in many of the ways in which we function. And so this is an important piece for us to understand that has long predated COVID, but also now is intersecting with COVID in the way that it shows up in communities, and the way that communities are responding to the leadership of cities and counties and states that they live in. And so all of this can then be linked back to, but what about the children? I mean, that's really what we're trying to focus on here, is understanding that the things that have happened but trying to figure out what is our path forward to be able to disrupt this cycle so that the next generation of kids are not fighting the exact same battles in the exact same ways and holding on to the exact same trauma that has been embedded in their DNA in the way that it has always happened. We are intending to use disruption as a positive to disrupt the cycles that don't work for us. And one of those cycles is adverse childhood experiences, or ACEs. And this is one of the ways that trauma shows up in communities. These are measures of abuse, neglect, and household dysfunction that occur before someone turns 18. And what we see is that it's often physical, emotional, or sexual abuse, physical or emotional neglect, as well as measures of household dysfunction that include having an incarcerated relative or experiencing mental illness or having a parent being treated violently, substance abuse, or even parental separation and divorce. We certainly recognize that this is not a limited set of traumas, but the original ACEs study, which was done over 20 years ago, linked these particular measures to a host of adult outcomes that we really had never thought about as being linked to childhood trauma. Things like diabetes and chronic obstructive pulmonary disorder and heart disease, but also things like missed work and depression and severe obesity, and some of the things that really we just had never connected to, maybe something that happened during your childhood and the ways in which your trauma has not been resolved then play out in what comes next in your life. And so ACEs are part of the framing of our All Children Thrive initiative, because what we're really trying to get to is how does what happened to children affect them, and what can we do to be able to disrupt this cycle? And so when we think about this, I mentioned that there are other sources of childhood trauma. So we have certainly the direct childhood trauma that's happening to a child within a family, but then we also have the community trauma of what we're experiencing and how those play out in terms of what's happening in a family, because families are rooted within communities, and communities exist within broader social factors. And so when we look at things like concentrated poverty and a lack of social support and forced displacement and personal and structural racism, we see how these multiple layers of trauma can exist and can feed on one another to really create a situation where our children struggle a great deal. And so I think it's important that as we're having this conversation, we're reminded of it's not just one source, but children are contending with all of them at the same time. And the end result is that children don't feel safe. And so when our children don't feel safe, we respond out of our fight or flight response in ways that are the exact opposite of the ways that we typically define people who experience success and well-being in our societies. They are often, those responses include being unable to concentrate, being unable to regulate emotions, being unable to self-soothe. And all of those things then, when children enter into our school districts, when children enter into the workplace, are things that we often end up penalizing instead of treating. And so we end up with entire generations of children whose unresolved trauma shows up in ways that we really look down on in society, but there was an opportunity for prevention. And so part of what we're coming today is talking about that role of prevention. And I mentioned already the impacts of childhood trauma, but these are many of them if we're really looking at what this looks like and what impact that has on our economic stability, what impact that has on the function of our cities. And there's a quality that epidemiologists use a lot called disability adjusted life years. And it really is sort of how much life and how much labor and how much in the way of time has been lost from someone, not just by dying, right, but by not being able to function in our greatest way. And ACEs certainly have the biggest impact on disability adjusted life years. So that brings us to, that's all the context for why All Children Thrive. And All Children Thrive came from Proposition 63, which is the Mental Health Services Act. And the goal really was to bring together public health advocates and the UCLA Center for Healthier Children, Families, and Communities, along with community partners in the California Department of Public Health, to really look at how we can prevent adverse childhood experiences and promote healing within cities throughout the state of California. The goal really was to look at the city as the unit because we recognize that cities often have the ability to be nimble and to move in ways that can really allow for us to be able to I don't want to call it experimentation, because that seems as if there's so much that's unknown, but to be able to innovate in some ways in those communities around what is needed and really begin to roll out some of the work that can happen in a way that can then build on itself, because we recognize that we don't just turn on a light switch and have this happen, but it does take a movement, and there is work that goes beyond that. And so we really see cities as a great opportunity to be able to work in neighborhoods, to be able to bring people together in a really powerful way, to be able to address and disrupt the trauma that people have experienced, and in particular that our children are experiencing in our community. So All Children Thrive is a community-led movement, and our goal is to transform the current systems so that we can improve child and family well-being. And that can be done by connecting people in the community, our residents, our youth voices, our officials, our caregivers, our healthcare workers, our educators, our service providers, all in the service of aligning our policies, programs, and resources. So the goal is to walk away with a network of people and places that are working together to co-design and innovate solutions, and really helping all children to thrive in the end, hence the name. And so I've talked through some of the current state of what we're trying to do, but this is a big picture map that was put together to help us describe the initiative, and with a big thanks to Leapfrog for their support on this. And what we're basically doing here is we're really trying to allow children and youth to center our work and prioritize that youth and community leadership, so that when we move as institutions, we're not moving and reinforcing some of the ways that haven't worked in the past, but we're actually involving the people who are most impacted, so that those voices are helping to shape what comes next. So as we're looking at those forces that drive inequality, we recognize that there is so much that stands in the way of our progress. But we also recognize that our communities have a lot of really fantastic resources that are untapped among them. And that instead of having an opportunity for few with this gate around it, right, that are these forces that drive inequality, we actually could deconstruct the tower and create a platform that allows a lot more people to access. And part of what we do, the way we do that, is a power shift and also a mind shift. And so we want to engage communities by talking about what is a shared vision and purpose, and how do we truly engage in joint leadership and do some community-led assessment and prioritizing. And then next, to think about how do we grow? How do we actually engage in cross-sector learning networks? Because there's so many cities out there that are doing really great work, but then another city over basically has to start from scratch and figuring it out, because there hasn't always been an opportunity to be able to share and to learn in real time. And also to be able to provide advocacy support for communities that have great ideas, but sometimes those ideas don't make their way into leadership and into part of the platform. And so really making sure that co-design element is there, because sometimes we can stave off the lessons we learn by involving more eyes and more voices in the process. And then really being able to provide support on what we have called for our initiative, the change packages, the things that we really want to work on, which I'll touch on in just a moment. And then the goal there is to accelerate the process. We often have, I know everybody on this call has probably been part of the engage and grow process in the past for some initiative. That's how we get things done. And the things that we do that we're most proud of often are when we have done those two steps really well. But then the next part of it, the part that sometimes gets lost, is being able to actually share that out with others and to do the community-led evaluation. So we're not just looking at what we set out to do, but we're actually looking at what did the people who were most impacted by this think about what happened, and how would they help us to be able to shape what comes next. Being able to collect the data that actually demonstrate our effectiveness, not just in long-term outcomes like heart disease and life expectancy, but also in some of the short-term outcomes. Being able to celebrate the ways in which maybe we've outperformed what was expected given the baseline, and figuring out how we continue to do that so we can continue to outperform and begin to close some of those equity gaps. And then certainly the sustainability and practices to keep the work going. And that is an incredibly important part of this work. One of the privileges that we have of doing this work is that it's funded by the Mental Health Services Act, which provides up to about $440 million a year in support at the local level for mental health. And so our goal is to be able to provide support in accessing some of those resources, especially for cities, because that money is given to counties in particular, but certainly cities are eligible to be able to be a part of that process and to be a key partner. And what we've learned from Heal Cities is that cities are a great and almost an ideal partner for this type of work, especially when it comes to looking at broad systems change and really affecting the things that are going to shape the way that cities function and form. And so in the end, we hope to create this platform instead of the tower that's separated from the people by a fence, where decisions are made by many people and they reflect children in the policies that are made, that we prioritize prevention and preparedness over just response, and that we're offering the social protections and creating the community wellness that we want to see by engaging in a whole host of activities that lead us to that end. So what All Children Thrive is an opportunity to build networks of people that transform systems. It's also this opportunity to co-design solutions and ultimately an opportunity to heal the adversities that are affecting California children. And I know we don't typically think about municipal governments as being healing. And that I think is part of the value add of this, is recognizing that one of the things that should be at the focus, in addition to the racial inequity assessments and all of the other ways that we really try to demonstrate the impact of our work, including, how much did we get back for how much we invested, we also should be looking at what did we heal? What were we able to address that was harmful in the past that we stopped? And that's not often a metric that we use, but it certainly is an important one and should be part of what we think about when we recognize that some of the trauma that's experienced in communities is because of institutional barriers. And what does it look like to actually heal that and to include more people in those very institutions? So what we focus on, and we have some these areas that we're going to be doing this work. Data kind of undergirds all of it. So we are really interested in making sure that we're collecting the right metrics and that we're actually measuring our success, because one of the things that we contend with is that there are so many great ideas out there that are implemented really well, but then we can't actually prove how they worked and what those core elements were that are necessary, the key sort of fidelity measures that you'd want to make sure that if you were going to try this elsewhere, you would definitely include. It also makes it difficult to be able to improve on a model that's working if you're not exactly sure what about it is working. And so data is really one of the things, and enhancing data capacity undergirds all of these focal areas. But we really want to focus on community mental health and in the non-traditional sense. Making sure that people have access to the support that's needed. We know that during COVID-19, calls to the suicide hotline have skyrocketed. And we recognize also that domestic violence calls have skyrocketed. And all of those suggest to us that there are some things that we need to do in the prevention space around mental health. We recognize that, eating well and exercising is something that we can do to be able to prevent some of the chronic illnesses that we may experience in the future, but we haven't employed the same approach to our mental health of not just waiting until we're experiencing mental illness or mental distress, but actually investing in this from the beginning to make sure we enjoy mental wellness. And a lot of that can be done at the community level and not just with clinical services. Also, healthy food access. We did some listening sessions and some polling as well of cities throughout and all of the mental health services agency regions throughout the state. And healthy food access came up as a really important thing. We know with the onset of pandemic and ABT and some of the school and library feeding programs that this is an important and especially important area during COVID-19. And certainly it extends our work with the Healthy Eating and Active Living Cities that many of you have worked on with us over the last decade. And of course, we would be remiss if we didn't include public safety, but this is including public safety from a public health perspective. And I will be showing just one example before we close out of how we are beginning to engage in this work and what that might look like for your own city as well. But certainly also youth and community enrichment. We are looking at what are the neighborhood programs, what are the ways in which youth are invested. I was really struck by attending an event recently. It was an outdoor rally with great distancing and masks being worn of some mothers who have lost children to gun violence. And I was really struck by just how clear they were on how we spend the money in a city very much is at the root cause of why their children aren't here anymore. And they all talked about the need for more investment in their communities to address the drivers of poverty, to make sure that their children actually had loving and trusted adults who were able to steer them, who weren't just their parents. And so when we recognize that, we see that this is, you know, part of what we're doing in terms of the prevention work is really engaging youth where they are as they are developing. And this is a great way to be able to do that, and thinking specifically about what do neighborhoods need in order to be able to provide for our youth and to enrich them in ways that will last throughout their lives. Certainly, again, housing has been an issue, especially across the state in California, but certainly during COVID-19. And so looking at some of the ways in which we can engage around housing and some innovative, you know, strategies to be able to offer protections to people, but also to be able to stabilize both cost as well as access. And then a big one is community engagement and decision-making. This is one of the things that we are most interested in working on, because so much, I always like to think of this as in sort of a Pollyanna or a very altruistic way, and that I think most people who are engaging in work really want to do a great job. But sometimes we are not engaged with all of the right people to make sure that the outcome is best for everyone we're intending to help. And I think this comes from our love of superheroes, who very rarely consult the people that they are out saving to see if they want them to be in the area and if this is what they would most want them to do. And so while we love our superheroes and have a profound respect for the role that they play in society, we don't want to engage in superheroism. We actually want to engage in engage the community in our decision making, because we recognize that, you know, maybe the community would say, hey, Superman, we don't need you flying around, you know, saving, you know, folks from, you know, crashing trains and crashing planes. We actually need your help with some other thing that Superman certainly has the skills, talent, and ability to be able to help out with. And so that's really what we're looking at as one of our pillars, as well as how do we engage in decision making that fosters long-term engagement and also allows for the outcome to be the best one we could come up with, instead of one that maybe overlooks something that, had we engaged the right folks, would have been included. And so the steps for this process are, you know, engaging the communities across California to participate and act, and then helping folks to assess their own data and understand some of the root causes of child and community adversity. Because what we don't want to do is operate in the space of a snapshot of here and now, and this is what we see, and not recognize what may be causing what we see may be different than the symptoms. And so we want to treat the root and not just the symptoms. And then we want to talk about setting goals and designing a roadmap for success, a roadmap that can extend far into the future, but making sure that we're also adopting plans for action. And so that it's not just a planning process, but it's actually a planning and doing process. And then throughout the network, we actually engage our communities to develop the best practices for transformative change. And that means being able to engage other people who have done this similar work, so that we're also taking advantage of the lessons that have been learned from that, and being able to sometimes jump to step 2 instead of having to go through all of the processes of step 1, because step 1 has been done in other places and we already have some lessons learned. So that's really the key part of the learning network. So we would love for everyone who is on this webinar today to be able to join in and participate in All Children Thrive. And the reason that we'd love for you to join in is so that we can actually bolster and unify so many city initiatives that exist. We think that there is a way that we should all be working together, and we recognize that sometimes, you know, our silos or allow us not to be able to get the support that we could enjoy and that could really benefit us. We also think this is a great opportunity to be able to leverage the MHSA funding that is going to be really needed. You know, mental health is one of the things that has been impacted by COVID, and luckily there is already a built-in funding source that will be able to help to support some of these ideas. And we'd love to be able to see cities be more engaged in that process, even though the funding exists at the county level. That is an intended partnership and one that we think really has a great amount of potential. We also think that this allows us to broaden our civic engagement. I think we've all had the experience of wanting more people to be involved in recognizing the need for diversity in thought and diversity in experience, and making sure that our outcomes are as best they can be. And this really allows us to do that by strengthening really effective community outreach and being responsive to the needs of our communities, and engaging in this equity work in a way that lifts up the people who are most impacted. And like Heal Cities, ACT can be a signature initiative for a city. And so we would love nothing more than for cities to really be branded by and to be very proud of the work that could be done in All Children Thrive, and looking forward to addressing the trauma that can often come along with how our cities have just been designed from the outset to function, and really reconsidering some of our foregone conclusions about what is possible. So what participation would look like for anybody who is on this webinar is joining and engaging in your city's design team. And that means that a design team would be comprised of a community-based organization, which would typically be sort of the lead organization, along with a youth member, at least one community member, as well as someone from city leadership and someone from county MHSA. And so that team is put together so we can really think through what is needed, what already exists, what are the possibilities, and really be able to co-design together what this can look like, including the community outreach. And then supporting the adoption of a resolution to become an ACT city. That's really the next step after everybody comes on, the design team is formed, is then saying, okay, we are committing to this process. And then joining the All Children Thrive network to build better systems for children and youth. And that's part of that learning network that we come together as you've identified priorities and spaces that you're already working in, or want to deepen your work in, or want to start work in, that we're there to support you and to make sure that you're connected to other folks who are doing this work. And then, of course, the community-led assessment is part of that, of what's happened. It's an ongoing process to make sure that we are capturing the momentum and movement that happens within a city as this work is engaged, and that process is an ongoing one and not just a one-time sort of listening session, but actually ongoing assessment of how things are rolling out and how they're working for the community. So to give you two examples of some of the work that could be included if you were to participate in All Children Thrive, the first one is reimagining public safety. And I'm sure everybody on here has heard these calls to defund police, and it probably had your own share of, social media arguments over, is that good framing? What does that mean? But don't we need police, and all of that? And so I like to use the term reimagining public safety because that's really what we're looking at here. What we're looking at is that the current status is that public safety is really limited to police, fire safety, and emergency management. And if you think about those are all emergency responses. It's all about, what do we do when something goes wrong? And what from a public health lens we're asking is, what if we imagined a world where public safety focused on prevention? Where instead of spending all of our dollars on making sure that we had a force of people who were ready to go when emergencies happened, that we considered, how could we maybe avoid more emergencies? What if we thought about, how do we include our community and youth partners in this? What if we actually considered, as part of public safety, having stable and affordable housing? Because we know in places where that's true, there are fewer incidents of violent crime. What if we, focused on quality education, because we recognize that many people who occupy our prisons are people who did not read at grade level or did not complete their education, and that they are overrepresented in our prison systems. Maybe what would happen if we actually looked at making sure that healthy and accessible food was available, because we know it's one of the adverse childhood experiences and also significantly impacts children's ability to be able to, perform in school, and has long-ranging impact on our overall health and wellness. What if we look at economic security and poverty, which is one of the drivers of crime? We see worldwide that in places where people have more trauma and have less funds, that we see more violence. And what if we actually considered that to be part of public safety? Instead of just trying to address the problems and pretend that they won't go away, what if we actually tried to get to the root of the problems and restructured our functioning in this way? What if we had crisis workers that responded to non-emergency requests? As many community organizations have already, from a grassroots perspective, built up in their communities. What if we actually look to that expertise and recognize that maybe our municipal systems have a lot to learn? That's reimagining public safety. And one of the ways that we could engage in this is a resolution that is currently making its way in the city of Sacramento it's made its way through the Youth Commission and will be heading to City Council, where there's actually an expansion of that definition. And Mayor Steinberg just this morning released an op-ed in the Sacramento Bee talking about exactly this, about how he hadn't really considered prior to some recent call outs just how much of his ideas for the city were rooted in this is the way things always have been, and maybe we need to reimagine what this looks like. And so this is an example of us pulling together a policy response to something that really could transform the way that a city is functioning, and really make it so that everybody's safer. Because I think the question at hand when people are saying, well, who would you call if you get rid of the police department as we think of it, or if you defund, who's going to show up when I have an emergency? And we haven't actually asked, how can we prevent these emergencies in the first place? And so that's the kind of public health thinking that I think can really take hold when we think about what does safety actually look like, and are we doing our best to achieve that? Another way that we're doing this is we talked about the design teams as having youth members on them, but we actually are planning to also have youth design teams. And this was really decided because we recognize that youth need their own safe spaces to be able to engage with one another, but also, especially in the midst of COVID-19, recognizing that youth have had their social connections disrupted, and that they also are in the eye of the storm in terms of being impacted, but they are not the ones who are able to vote. They are not the ones who are polled when we ask, how would you like to spend this money? They are not the ones who we reach out to get policy ideas, but they have them. They're impacted, and there's a lot that we can learn from them. We just have to design our listening instruments to be responsive to their developmental stage, and to be able to hear from them. And so having these youth design teams serves two purposes. The first purpose is to be able to make sure that those voices are also included in the decision-making process. But the second and the important one is to bring the youth together and actually have this be a way that they are engaging in social support. I know from my own work in community organizing, I always get a sense of mental health support and release from being able to come together and work around an issue. And that's no less true for our younger members of our communities. And so making sure that we have a space for them to both care for each other and care for themselves, as well as to really think about how they can shape a future, brings us to a gratitude, which is part of the ways in which we can engage in self-care, and allows us to align our eyes on what's hopeful, what's in the future, and what's possible. And so the youth design teams are really a leadership pipeline as well. To better understand and promote policy changes, we want to engage all of them, because our ultimate goal is in our title, which is that we want all children to be able to thrive. And we recognize that that does mean that we're going to have to do things a little differently and make sure that we are supporting and elevating voices in a way that allows our leadership pipeline also to look different and to engage differently. So as I mentioned, we are looking for cities. And so I wanted to do a very clear ask that if any of this sounds interesting to you, if you'd like to have more information and conversation, and we certainly have time to answer questions over the next 10 or 15 minutes, but please reach out to Katie Speziali. She is a program manager for All Children Thrive, and she is our point of contact for cities that are interested in becoming part of All Children Thrive. And so if that's you, if your team would like to sit down and learn more, if you'd like to learn more about what are some of the other policy examples, if you'd like to figure out, sort of who in your city might be the great point of contact and how this work could be integrated, please reach out to Katie. Her email address is ks@phadvocates.org. And we've also listed her telephone number here with Public Health Advocates. Please reach out and let us know that you are interested, because we are looking to move beyond our first 4 sets of cities that we've been engaging to expand and include lots more cities in. Our hope is to have over 60 cities engaged in this in All Children Thrive. So, and we actually do have for our design teams, we have some mini grants that'll be available to the CDO partners to be able to help to fund some of the work that the design teams are working on together. And so we are hoping to be able to have as much support as we can from cities that are really interested in doing this work. We also have cities that are interested in being part of our learning network to be able to share some of their best practices. And those cities are coming throughout California and throughout also the rest of the country. So it's a really exciting time to be thinking about doing this work, and the need need, I think, has been really laid out very clearly for us, especially in the first 6 months of 2020. So with that, I want to stop and do some Q&A and allow for some thoughts and responses.
Thank you so much. Why don't we make it a little easy for our members? If you want more information, would you please give us put your email address in the chat box and we'll send them to Katie. So Katie can directly,
Perfect.
is that okay? So Katie can directly contact you and get you more information about this program. So if you're interested in it, please put your, we're getting some people in there. Thank you so much. Put your email in there and we will make sure that Katie gets it and she can contact you directly. Getting quite a few. Okay, so we do have some questions.
Yeah.
For you.
So the first one, hi, Charles. The first one is, given that so many of the investments made in the mental and behavioral health space for children are done through the counties, what are some specific things you think cities can proactively do to improve or support the well-being of children? That's a really great question. And, so I think one of the things that we can certainly do is, the reimagining public safety resolution, in part because that allows us to be able to really rethink where our investments are going at the city level. And so much of that structure is not specifically designed around, I think sometimes in public health, we also have this challenge of looking at services and thinking that because the counties in California mostly cover healthcare services and house public health, that means that the cities don't really have a responsibility here. And what we've learned from Heal Cities is that there's actually a great deal of the infrastructure work that needs to happen at the city level that's not best suited for the counties. And so that's an example of one of them. I think also looking at the ways in which cities that are engaged in some of the housing support can actually look at their policies around that as well, to make sure that children have a safe and stable environment, to make sure that the services that are provided are needed. One of the challenges we've seen during COVID-19 has been, this increase in domestic violence calls, but also they're happening later and people are reluctant to reach out in some ways because of fear of criminalization. And so really recognizing what that might mean for the safety if those services are housed elsewhere. The same thing is true for child abuse. We've seen it showing up later because some of those first responders and students, students who are in school are not there because their teachers aren't seeing them. So there are some ways that I think at the city level and engaging with some of the structures that cities engage with most, that we are actually able to make some real changes in child well-being that are specific to the authority that cities hold within for the people that live within their jurisdiction.
Real quick, we have a question about how can you access this webinar recording. You can access it through the League's website at cities.org/coronavirus. And this will be posted in about the next couple days. And you can actually take that link and send it to your fellow city members so they can also be a part of this great campaign.
Absolutely. And then I see another question. Are there efforts or discussions to bridge cities' intent to have positive impact on youth with faith-based efforts already in play? Absolutely. So one of the things that All Children Thrive will help to facilitate in the beginning of the process is making sure that we understand what else is already happening. That's why the folks that are being brought together are going to be folks that are already working on this in the community. The hope is that whatever partners are already a part of your community and are already doing some of this work, that this can bolster them. And that may even be that your faith-based leader might be somebody who was on your design team. And so that would certainly be something worth engaging in. And that would be strongly encouraged, that this is not intended to supplant other work that's being done, but really to help to provide some support and focusing on some of these particular topics in a way that we think involves both systems change as well as a focus on youth. So you do not have to feel like you are going to be in initiative overload. We are more than happy to align with, and in fact, really strongly encourage if there's already been some relationships developed or a working platform to be able to engage in. That's even better because it means that you can get to the meat and potatoes. I shouldn't say that. I don't even eat meat and potatoes that often. You can get to the healthy food section of the core of that to be able to do this work really well.
I love it.
And then there's a question from Mike Labar, the mayor of King City. Hi, Mike. Is your organization looking at state housing policies that can be adjusted or removed that would give cities more opportunities to build affordable housing? That's a great question. And what I would say back to that is yes, in part because we are also working with the Essentials for Childhood initiative, which is a statewide initiative that is run by the Department of Public Health. And so we are in close communication and partnership with the folks that are also working on state policies. And so our work specifically for All Children Thrive is looking at the local level, but there is a great tie-in with what Essentials for Childhood is doing and how we can make sure that things are pushing forward on what's happening at the state level, and that the cities are ready to sort of pick up, to use a basketball analogy, the alley-oop, and to get, a slam dunk from that. So yes, there's a great interplay between the state and the cities in terms of housing.
You talked about there's about 4 cities who are already engaged in this initiative. Are you allowed to say who they are?
Yes, actually, we already have some work happening in Fresno, in East Palo Alto, in Richmond, and in Stockton.
Great. So those are all cities that you can get, if you have contacts in, you can ask them how great this initiative is. So since we are being socially distanced, is the initiative talking about anything on how to use Zoom or how to use electronic platforms, more like the face-to-face, because it's so easy not to read emails nowadays?
Absolutely. Yes. So part of what we have actually been doing is building some of our own internal capacity on how do we do things electronically? How do we make sure that what we do electronically is engaging? And how are we going to be able to actually bring people together in the learning network in a way that is meaningful without having face-to-face contact? And so admittedly, we are also 6 months into the pandemic, and so we are still learning, but that is one of the capacities that we've really been expanding, is how do we do this work so that we can all stay engaged, and so that we're not just participating in Zoom fatigue. And I'm sorry for contributing to those of you who have Zoom fatigue with our webinar today, but we are really going to try to find ways to be able to engage. And we're doing the same thing for our youth design teams as well. How do we engage them in ways that make sense and that are native to them, so it doesn't feel like it's so much work to be able to be a part of this?
And the work that the initiative is doing is lifelong work. So it will be here next year and next year after that, really helping support our children. You've given us such great tips. I know that you've been working with this and other projects. I like to ask our speakers to leave one final thought about if there's one thing that you want to leave them or one thing you've learned, anything that you want to tell them about either All Children Thrive or just what you're doing with the pandemic. This is your time.
That's a big open question. I think what I really want to impress upon everyone who's here is that we see this as a great opportunity, and there was so much of this work that was in place long before COVID-19 ever happened. And then as we started thinking, what do we need to do to respond to COVID-19, we realized we just need to highlight, we need to tie in and explain why what we were already planning to do has even greater importance right now. And it was really a pleasure to sort of be able to be in that space where we were already thinking about so many of the things that have been highlighted as real challenges and have been exacerbated during COVID-19. And we're already thinking about what these vulnerabilities look like and how they could become worse. So I think we're really well positioned to be able to be responsive in this moment. I also think that, the funding that exists for the Mental Health Services Act can't be understated. I have not had many opportunities in my life where the money exists and the challenge is figuring out what to do with it, as opposed to it being in the opposite direction. And so the place where I see the greatest value add is that a lot of that money has been spent at the county level and hasn't always been spent at the city level, but cities have a great deal that they can do in this work. And so being able to identify that as a funding source for proposed work, I think is a really great opportunity that I'd love to see us avail ourselves of, especially in a time where our city revenues are down. And this really could help out in more ways than just, I'm not looking at it as replacing revenue. I'm looking at it as actually expanding capacity and thinking about how we work as smart as we do hard. And as effectively as we do with heart. And so that's really what I'm excited about supporting cities, because I love cities, like in a weird, nerdy way, but I really do. And I think this is a really awesome opportunity for us to work together.
Well, it is official. You are our favorite speaker. We enjoy working with you and hearing your amazing work that you are doing. Thank you so much. We really do appreciate it. We have a lot of people who are interested in joining. We cannot thank you enough. We do have one final question, if that's okay.
Yes, I actually saw it. So for the cities that are already partners, which departments are the main contact for the All Children Thrive program? It varies by city, and it really just depends on sort of who picks this up. We have some cities that we're also engaged with that are going to be part of our learning network, but that are not pilot cities, and they have like an office of the child, or they have youth staff that are already engaged in some of this work. So that's kind of a natural place for this to fit in with the city. And in other places, it's the staff of, the mayor or one of the council members that are engaged in. So it really just kind of depends from city to city on who's already working on this and where it sort of naturally fits in, because we do want it to have a good, solid home. Housing is not just something that we're thinking about from a policy standpoint. We're also thinking about it from our initiative standpoint. And we want safe and affordable housing for all of our initiative work as well. And so wherever it can find a home is what we're open to. We don't have any prescriptive boundaries on who and which departments from a city can participate.
Thank you so much. We really appreciate everything. And again, you can find this webinar on cacities.org/coronavirus. We encourage you sending it to your fellow staff members so you can get involved. Thank you so much. We really appreciate your help.
Thank you. And thank
Have
you.
a great day.